I just want to pass over then to Chérie and to Bethany, who will talk about the wider project and to the findings and the attitudes to armed forces in Northern Ireland. And then we'll switch the video off and we will have some questions and discussion.
So just a note of thanks to everybody that's been involved in this work, to Paula, to Gillian, to Bethany and to the wider Veterans Project team, so to Matthew, to Jana, to Margaret, to Martin. Just thank you very much for everybody's help. So what I want to do today is I want to talk to you about a specific module of the public attitudes to UK Armed Forces in Northern Ireland. Now this is part of the wider Northern Ireland Veterans Health and Wellbeing Study, so it's apt to give you a little bit of context and a little bit of background to the wider Northern Ireland Veterans Health and Wellbeing Study. So the overview of the presentation that myself and Bethany will jointly deliver today is that I will first of all give you that background and the overview, and then I'll hand over to Bethany, and Bethany will talk to you about public attitudes to armed forces in the UK, and then we'll discuss the key findings of the results today, and we'll discuss the discussions and the recommendations that relate to those results. Okay, so background to the Northern Ireland Veterans Health and Wellbeing Study. The Northern Ireland Veterans Health and Wellbeing Study is essentially two large projects that were funded by Forces in Mind Trust. The first of those projects was funded in December 2015 and the second was funded in July 2016. But because there were two projects running parallel from the same funder, then we merged them into a bigger, larger project comprising multiple work packages that we now refer to as the Northern Ireland Veterans Health and Wellbeing Study. So ultimately the programme of research runs for 4 years, and the main aim of all of those work packages across the two main projects is here on this slide. So to make recommendations on how support available to veterans in Northern Ireland might be optimised in terms of structures, protocols, communications and services. Now that's one main aim, but there's an awful lot that goes underneath that, and what I would like to do today is I would like to talk to you about the two reports that we've already published, and then I'll give you a little bit of a rationale in terms of where today's project came from and why we felt it was important to embed it within this wider study. So report number 1 is termed Supporting and Serving Northern Irish Veterans. Some of you may have already been aware of this report, you may have read the report. Essentially the aim of this was to find out what services and supports are available. So this is across the whole remit of supports and services, so welfare, housing, mental health, employment, physical health, and then how these services communicate with each other and with other bodies. So for example, how do the voluntary and community sector communicate with the statutory sector and so on, and places like the MOD. So what were the key results in this report? Well, first of all, we found 19 veteran-orientated charitable organisations in Northern Ireland, and one of the key findings here was that in contrast to the 1,818 organisations in England, this is comparatively and much, much smaller. And then in Scotland, there's 419 organisations. So you can see that there's a huge difference between 19 in Northern Ireland, 419 in Scotland, and then almost 2,000 in England and Wales. We also found that the sector relies predominantly on informal relationships for referrals and for collaborative working. This is highly prevalent, and in all of the organisations that deal with veteran support services, there were lots of overlapping membership. So we would talk to people and we would always hear the word, we do this, we do that, and we weren't ever really clear who we was because all of this overlapping membership. But everybody did, of course, focus on veterans' issues. One of the other key findings of this report was that there was a lack of focused mental health services. So the mental health services were being provided through some organisations and predominantly through combat stress in Northern Ireland as well. And of course we found that when we were liaising with key stakeholders like service providers and veterans, that there was significant security and safety concerns around engagement from the veteran population with those services. So our main recommendation from report number 1 was that we would essentially make a call for a well-resourced and formally recognised body in Northern Ireland where key stakeholders in the region could meet to develop recommendations, provide responses and support key agencies in developing guidance and protocols which affect veterans in Northern Ireland. And since this report, we have a brand new Veteran Support Office who fulfills this recommendation. Okay, so report number 2 was the Current and Future Needs Report. This was a little bit of a different study because the aim here was to identify current and predict future support needs of the veterans themselves. This was conducted in 2 parts because we conducted 20 in-depth interviews with 20 service providers across the sector, and then we ran 13 independent veteran-led focus groups. So we asked about current and future support needs from the perspective of both the service providers and from the veterans themselves. The key results here were that we identified a number of barriers to support. For example, we heard a lot from the veterans themselves and the service providers about the concept of military stigma. So being affiliated with or in the military was felt to be stigmatised within the Northern Irish population. There was a lot of discussions around mental health stigma, so people didn't want to disclose or come forward to seek help if they were having any mental health issues. Again, there was a lot of discussion around safety and security concerns related to the disclosure of people's military or veteran status. And there were lots of issues disclosed in terms of trust, so trust in public services, for example. And of course, there was a lot of hypervigilance, which is a key indicator of mental health issues. Hypervigilance is a key symptom in things like post-traumatic stress disorder, where people are very hypervigilant within their environments. So the key recommendation from this report was essentially a call for better community integration of the military and military veterans through events such as Armed Forces Day, and a public awareness training campaign to facilitate greater understanding of veterans' issues in the public sector and in service providers themselves. So, how does this bring us to today and to the report that we're launching on the public attitudes to armed forces in Northern Ireland? Well, the aim of this is to identify current public attitudes to UK armed forces in Northern Ireland, and the reason that we did this was because throughout the Northern Ireland Veterans Health and Wellbeing Study, as I've just explained, there were key actors and participants in the research who identified the importance of public perceptions and attitudes to military veterans. So we needed to try to develop that evidence base around this. It holds importance both in political spheres and for veterans themselves. So we heard about these concerns from the veteran service providers, wider stakeholders, and the veterans. So we had a multi-perspective stakeholders. Service providers found it difficult in providing veteran-specific services in an environment where the military and being a veteran was politicised and stigmatised. And veterans reported that they do not feel comfortable accessing some public services, particularly where they might need to disclose their veteran status. So you can see why understanding public opinion around the UK Armed Forces is very important from these perspectives. And of course, with all these consistent reports of negative public attitudes, if you don't have an evidence base in order to answer those questions or to alleviate those concerns, then you've really nowhere to go. So as a evidence-based academic research team, we felt it was really important to build that evidence base. And now I'm glad to say that we do have an evidence base on the public opinions of the UK Armed Forces in Northern Ireland. And at this point, I'm delighted to hand over to Dr. Bethany Waterhouse-Bradley, who will discuss the results of our study. Thank you very much.
Okay, so just a quick precursor to say I've got a lot of slides here, and that's basically so that you can have a visualization of the data if we want to talk about some of it later, but don't panic, I won't keep you here all day. So I'm going to talk through very quickly just about some of the public attitudes in GB, because this kind of piqued our interest as well as the other reports around, because one thing that we know about the present attitudes towards the UK Armed Forces in GB is that it's the highest ever recorded. And this is in spite of a general sense of people moving towards more pacifist attitudes and having a resistance towards some of the specific deployments that people are sent to, but that those seem to be separated out from the individuals serving in the armed forces themselves. So it's 83% have a high or very high opinion of the UK Armed Forces. But there's also, in addition to this, a real strong perception that there's a lot worse mental health, and that there's higher misuse of alcohol within this population. And that doesn't pan out when you actually look at the statistics and evidence base that they have on UK Armed Forces personnel and veterans in the same population. So the kind of perception is quite different from the reality, and we were curious to see how this would play out in Northern Ireland, which is the only place in the UK where the UK Armed Services have actually been deployed. And we already kind of have a lot of generalizations and opinions and kind of perceptions about what people will think of the military here, I think, and how that might be divided up. So we wanted to get an evidence base on that. And we also wanted to try and get an idea about how people perceive the Armed Forces personnel, their mental health, their alcohol use, and also just a general respect for that population internationally, as well as the specific institution of the UK Armed Forces. So I'm just going to talk you through some of the key findings, and we can come back during questions to anything that you have in particular, but we're going to kind of focus on what we thought were the surprises, because there's things in here that aren't terribly surprising and might have been a little bit predictable, and there's some things that really were quite striking from our perspective. So the first thing that we wanted to do, we wanted to look at, because of in the UK Armed Forces attitudes, there was this kind of separation out between someone disapproving of a deployment and someone disapproving of someone in the UK Armed Forces. So we wanted to see in Northern Ireland, could people separate out issues that are legacy related and the specific behaviour of the UK Armed Forces during the Troubles in Northern Ireland versus the UK Armed Forces as a whole in the present day. So as you can see, it's fairly split. With quite a high proportion, over a quarter of people saying that they have a neutral in either high nor low position. And in terms of then looking at in 2017, you can see that the everything kind of on the higher end goes up a little bit. Attitudes do become more positive. There's a very high opinion, increases quite significantly, as does the neutral position. So you're seeing a very low at 14%, and that decreases right down by half to 7% if you're talking about specifically looking at the UK Armed Forces in 2017. And the demographic breakdown of this, there's very clear, the males, older people, and people from the Protestant community were generally, and this is pretty much across the board in terms of having more positive attitudes, they were the biggest predictors of having positive attitudes towards the UK Armed Forces, with quite a significant older population, and this gets even more significant in the next slide, where you've got 56%. So higher, very high, and neutral is in the blue and red, and then the lower opinions are in the purple and green. So you can really see a big difference between how the attitudes change when you ask people specifically about the Troubles and ask people about the UK Armed Forces today. And then when you ask people directly, do you feel more negatively about it, though, there's quite a big chunk of people that say that they either don't agree or disagree, or that say they don't agree at all, or strongly disagree. So the vast majority of people say they don't have a difference, but actually that plays out quite differently when you look at the data. But then, so one of the things that wasn't necessarily terribly surprising, but what was, I think, surprising for us was the social distance questions. Once you started talking to people about individuals, either living next door, marrying a close relative, or joining the armed forces themselves, people's comfort levels with that seemed to be a lot more positive. So feeling don't know and neither uncomfortable nor uncomfortable are the ones in the middle here in the green and red. The negative or discomfort are in the orange and blue, or orange and teal, turquoise at the top, and then the more positive ones are at the bottom. And you can see that the positive attitudes or higher levels of comfort do go up significantly again. So you're seeing generally as people's level of comfort with someone living next door, marrying a close relative, or a family member joining the UK Armed Forces, they are generally either neutral or unsure, but over more than most positive. So then looking at perceptions of what this population's mental health and alcohol misuse are like, we really see a mirror of what is happening in the rest of the UK. If we asked if there's alcohol-related problems in the armed forces, 40% of the population agree, and 19% of people are neutral. There's only 15% of people agree or strongly disagree with that statement. So again, we're seeing it's very similar because it's about 50% in England that agree with that statement. So it's a little bit less. And the biggest predictor of people believing that there was alcohol-related problems with people serving the armed forces was actually being from the Protestant population and being in the 45 to 54-year-old age group. So those predictors were consistent with mental health as well, you'll see. So public opinions on the mental health issues in the UK Armed Forces, again, we're seeing a mirror of what we see in England. The majority of people think that there are poor mental health, that people in the armed services or who are veterans have poorer mental health than the rest of the population, with only 10% disagreeing or strongly disagreeing. And again, this time we've got 70% of Protestant respondents that believe that mental health is poorer for this population. And again, 70% in that 45 to 54-year-old age group. So you can kind of see the interconnection between those two things as well, the alcohol misuse and the poor mental health outcomes. So I'm going to talk a little bit, one of the things that really spurred us on to look at this is the issue of the Armed Forces Covenant. And I'm just going to very quickly talk about, because 80% of respondents had no idea what the Armed Forces Covenant was. So there's two core principles to the Armed Forces Covenant, which is a principle that's held in the UK, and it's like a contract between the government and the UK Armed Forces and their families and veterans, the wider public and the public and private sector, to say that service in the UK Armed Forces will not disadvantage you, and that in some circumstances, for the languages for people who have kind of given the most, that there's special consideration that may be appropriate. And this is for people that have been injured or bereaved and quite significant loss or injury. And the way this plays out in the UK is in some quite focused specialist services. For example, there's quite a lot of investment in prosthetics in some parts. There's targeted mental health services and specialist mental health units. And these are all in the statutory sector, as well as giving, it's underpinned by an investment of £10 million per year and to be distributed across the UK. And that goes through both the statutory and voluntary and community sectors. In Northern Ireland, there's no official implementation of the Covenant. It's not officially adopted in Northern Ireland. And there's debates around whether or not it contravenes the equality legislation in Section 75 here. But there's been a lot of debate around that. There's debate that people would imply that this is really about how politicized this issue is in Northern Ireland. And there's some publicly recorded debates in Hansard that would kind of demonstrate how that plays out actually when these discussions happen. And the Committee for the Administration of Justice and the Northern Ireland Human Rights Commission have both talked about the fact that there's absolutely no, the first principle of the Armed Forces Covenant, there's no conflict at all with Section 75, and that there's examples of kind of looking at more positive support and proactive support for some groups. For example, addressing rural and urban differences in healthcare, where you can see that something like some of the things that happen under the Armed Forces Covenant in England wouldn't be problematic with Section 75 here. So So we wanted to ask people about the Armed Forces Covenant. The majority of people had, as we expected, no idea what it was. And people that had, sorry, don't distract you with results that we're not talking about yet, but people that had family members or family connections to the UK Armed Forces were a lot more likely to know about it, but there was still quite a large chunk of that population that didn't know about the Covenant either. But we kind of anticipated that, so we asked people about the principles of the Covenant without asking them specifically about the Covenant. So it explains the Covenant, and then we asked people, is that generally fair or unfair? And 50% of people said definitely fair, and 28% of people said probably fair. So a real overwhelming majority for supporting the fairness of the Covenant principles. Excuse me. And you can see there is a substantial difference between Catholic and Protestant populations here, but that's just because support is so overwhelming in the Protestant respondents, because it's 64% of the Catholic respondents think it's fair or definitely fair. And again, you'll see that the age group, the same age, I mean, there's very little difference in the age groups, really. And you see much less discrepancy between demographics of respondents in these questions. We then wanted to see if you kind of applied it in action, would people continue to support the fairness of this, if you could see what it actually would look like in practice potentially. So we gave people scenarios, and this is where the piloting and the team for the Life and Time survey were so useful, because they came up with the idea of putting these scenarios on cards because people struggled with the length of the scenarios. So people had a chance to really read these through and think about them. So we give specific scenarios about getting priority mental health treatment. Again, overwhelming majority supported that. Similar breakdowns in terms of demographics. The next scenario talked about priority health treatment and housing treatment more generally for a veteran. And again, majority fair and unfair or definitely fair. And again, there's a little bit more discrepancy then between kind of religious groups, and a little bit more discrepancy with younger people. But you can make some inferences about kind of shortages of supplies that are higher in Catholic areas in housing, and younger people dealing with issues with mental health maybe at higher rates than some of the other populations. So people that are dealing with the lack of resources in those areas, there's a potential that might actually influence the willingness for those kind of specialist services to be for people to be prioritized in those services. But then looking specifically at housing, again, looking at the idea of someone being disadvantaged because they'd come off the housing waiting list during deployment and then come back, should they be able to be put back on the housing list where they were before, which is something that does happen in other parts of the UK, and the majority of people, again, believed that this was fair. And again, you see those discrepancies come in, but we would wonder really if that has a lot to do with resources to those specific populations, rather than it being a legacy issue, a direct legacy issue, because of the general agreement and principle of fairness. In the other areas, the discrepancy is not the same. And then finally, this is talking about IVF treatment, and getting an extra IVF treatment. And again, overwhelming support for that. With very low level, and again, you'll see those slightly lower in the younger population in Catholic, but still the majority of those respondents. So then, following on from that, we said there's specialist mental health services in England at present. Do you think that it would be fair for that to be enacted in Northern Ireland? And this is even higher than the other areas, which might be related to the fact that people believe that this population has such high mental health needs. And again, we're heading back up again to the smaller discrepancy between Catholic and Protestant groups and the younger and older demographics. So that's a very quick run through of the main findings. Generally, yes, attitudes in GB are overall more positive than in Northern Ireland, and some of the demographic differences in terms of younger people and older people and Catholic and Protestant play out a little bit in what we anticipated, but actually when you start to personalise that, when you start to separate people out from an institution and policies related to that institution and talk about individuals and individual needs, actually there's a very different story there, and it's a story about empathy and fairness and people wanting to see people that need things get the things that they need. Those with strong family connections have much more positive opinions towards military personnel, and connections were the most significantly predicting positive attitudes for Catholic respondents. So that contact with people that are related to the UK Armed Forces really increases the likelihood that a Catholic respondent will have positive attitudes. In terms of specialist support, we saw overwhelmingly majority of people believe that specialist support services are acceptable and very fair. In the most part, the biggest chunk was people that thought it was definitely fair. And this really follows on then from the need that we have found coming directly from the veteran population, that 19 voluntary and community organisations and no specialist statutory services outside of the aftercare service, which is specifically for veterans that served in the Troubles, which has the potential to be expanding out next year. But there's real positive implication here, I think, and we talked about kind of in a post-conflict society, because really if you think about how recently this has been demilitarised in Northern Ireland, for attitudes to be changing at this rate, actually, and for people to kind of be showing positive attitudes at this rate, at this point in time, I think is a positive sign, is a positive story, and particularly the fact that people are able to kind of separate that out, that individual out from the institution. There is definitely a problem here with perceptions around mental health, and the stigma that we saw relayed in the Current and Future Needs report when focus groups with veterans that had that concern about stigma, this would kind of probably reinforce that. And we don't have data yet. We will have data next year from our survey looking at the mental health and alcohol use within this population, but we're not sure yet if that plays out the same way that it would in the rest of the UK, where there's a big discrepancy. And there's a lot of issues around the way the media covers stories about this population, suicide and PTSD, and the way that it's kind of portrayed in film and things like that. It tends to be highlighted, these quite extreme cases of poor mental health. So recommendations, very quickly. They really mirror a lot of the recommendations of our previous reports. Community integration, we see that the more connection that people have with people in the UK Armed Forces and veterans, the more likely they are to have positive attitudes. So that idea of really needing to build this into good relations and community integration is quite an important thing. Data collection, there's a perception, I didn't get into the slide, but there's a lot of kind of either perception that there is discrimination in public services against people because they've been in the UK Armed Forces, or people that aren't sure if that discrimination is happening. And that's also the case when we ask veterans themselves. There's quite a strong sense that they would be discriminated against if they disclose their service. But at the moment, we don't collect data in the statutory services to be able to say, well, actually, this isn't happening, or yes, there might be a problem here. So it's about kind of looking at how we can find a sensitive way, working alongside, recognizing the issues around disclosure and security concerns, how we can work with this population to see how we can kind of monitor services use. Raising awareness of the covenant, in particular with people that have relationships to the UK Armed Forces and may be affected directly by the covenant, because that awareness of that was low even in that population. Awareness training around some of the issues that might be facing this population for statutory service providers as well, because even having an awareness that someone might not want to disclose because they're afraid of the stigma and they're afraid of what that might mean for them in services is a step in the right direction to help people be able to deliver services more sensitively to this population. And then just really a re-examination of some of the issues around implementation of the Armed Forces Covenant here. There is not the public resistance that might be talked about, and maybe wondering if the politicization of this is happening more at a higher level than at a grassroots level. And so kind of having a little rethink about that. There's a lot of scope for future research. I think a regular incorporation of this into the Life and Time survey would be really useful, so we could see how attitudes actually change over time. And maybe an exploration of why younger people's attitudes are so much lower, because we're talking about a population that actually weren't around during the Troubles. So why is the younger population so much more likely? They are more likely to have negative attitudes in England as well, but it's a bigger discrepancy here. And really looking at this question around discrimination in the public sector, because we don't want that perception at all. There's no evidence at all that this is happening, but without some means of data collection, we'll have no way to refute that. And then really examining how the public and the UK public as a whole develop these perceptions around poor mental health and alcohol use, and really starting to interrogate where those perceptions come from, so that we can address it, so it doesn't really kind of emphasize that stigma that a lot of people are experiencing. So hopefully I haven't gone over too much. Thank you very much for your attention. We can